Hello and welcome back. This is Dr. Burton Schuler. I'm a podiatrist in Panama City, Florida. And today we're going to talk about a common problem, which is swelling of the feet. Many patients have it and we see it on a daily basis as a podiatrist. The medical term for abnormal swelling of the feet and ankle is edema and is a common problem seen on a daily basis. Most often, this swelling or edema is caused by some type of an abnormal breakdown in the circulation system, vascular system of the body. But this abnormal swelling can also be caused by many other reasons other than the breakdown in the circulation system, which I will tell you about in a moment. Edema is when there is an abnormal buildup in the body of a substance known as interstitial fluid. This is the fluid that is normally present in between your body parts or organs and in between groups of cells or tissue. Edema or abnormal swelling of the feet or ankles occurs when this excess amount of interstitial fluid accumulates in our feet or ankles. Again, it is not the interstitial fluid itself that is the problem, but it is the abnormal buildup of the amount of interstitial fluid. Now, specifically, the reason that people's feet swell is due to a buildup of the interstitial fluid. So the million-dollar question is, why does the interstitial fluid build up to start with? Now, in the foot, it's not due to a systemic problem like kidney problems or liver problems or heart failure, which I will mention in more detail in a moment, but it's due to what I call a micro trauma. If your foot does not work right day in and day out over 10, 20, 30 years, it is going to cause a trauma to your foot that will bring the interstitial fluid to build up in your feet. Now, the reason for this to occur is because your foot is not working right to start with. This is due most normally in the foot to something called abnormal pronation. Abnormal pronation is when your foot is not doing what it's supposed to be doing when you walk. And again, over a period of years, it causes a tremendous abnormal stress and strain to occur in the foot. Let me give you an example. Assume for some reason you bang your hand against the wall day in and day out for 30 years. And then one day you say, okay, I'm going to stop banging my hand against the wall. But that's great. Your hand's not going to get any worse because you've stopped banging it, but you still have 30 years of pain, swelling, and in your hand a lot of interstitial fluid that built up. Again, in the foot, it's because your foot doesn't work right and you're putting all this abnormal stress and strain, and besides getting plantar fasciitis or corns or calluses or bunions or low back pain, you will also get swelling in many, many cases. Now, normally, this occurs on only one foot when it's due to this abnormal trauma. And but when you have a systemic condition, the swelling can occur on both feet. We normally don't see pain when there is swelling on both feet or legs due to a systemic condition. Swelling of the feet, legs, and ankles is commonly caused by being overweight, can be caused by a blood clot, which is a very serious condition. It could be caused by various types of infection. If you in fact do have poor veins, which again you need to see your physician about, various kidney problems can cause edema, and various liver conditions can cause swelling of the legs, feet, and ankles. Of course, women who are pregnant uh, uh, will normally have swelling in many cases, and in a very, very severe case of swelling might be a sign of preeclampsia, which is, of course, a very serious medical condition. Women who are taking estrogen on a regular basis might also have swelling. Um, swelling can be also due to, as I said, heart failure, kidney problems, or liver problems that will cause a buildup of the interstitial fluid in your body. Finally, certain medications, as of antidepressives, blood pressure, calcium channel blockers can cause edema, and hormones. But again, getting back specifically to the feet, if you have abnormal feet, if your feet hurt during the day, uh, do not be surprised if your feet swell. It is because you're beating the daylights out of your feet, and due to the micro trauma, day in, day out trauma of you beating up your feet, will cause a buildup of interstitial fluid to build up in your feet and ankles. I hope I have given you some useful information. And again, thank you. And I'll see you when I see you. Thanks again.